If you look, this is one from the Wall Street Journal in September, and it shows that greater than 70% of people want to be able to email their doctor. They want to be able to receive reminders when they're due for a test or something like that. Schedule online. Slightly under 70 want to be able to receive test results online. But of course, in all of those cases, fewer than 10% are able to do that right now. So what this slide shows me is there's an enormous latent demand out there for IT as a part of that doctor-patient relationship. People are looking for it, but it's not currently available. So if we could tap that, what would happen? What we've tried to do with legislation we introduced called the Personalized Health Information Act is tap the doctor-patient relationship, which is really the strongest force in healthcare. I mean, it's what drives healthcare is that relationship between doctors and patients, and use that relationship to give PHRs value to consumers. And we can do that by tapping the latent demand that's in that last slide and making it convenient. Eliminate the need for people to fill out that clipboard that we all find so infuriating every time you go to the doctor and you fill out the clipboard. And particularly for chronic disease patients or people who are seeing a lot of providers, and every time you see a new specialist, you have to fill out all that paperwork again. But if your doctor said, hey, you know what, we'll save you the paperwork, just fill it out one time. Let's get your medical history, let's get your current problems and so forth, and put it in a PHR, and we'll use that PHR instead of the clipboard, and you'll just double check it before when you get to the office. We'll print it out for you. You'll just sign it and say, yes, this is all currently accurate. And that would certainly make a lot of people's lives a lot easier. Gives people a way to stay in touch with their physicians. We can work especially with chronic disease patients who are already, so many people are have their banker's box full of records that they themselves carry from place to place, because who knows if it's when or if it'll get there if you leave it to the providers to communicate with each other. So many people carry them around already. And this is, of course, particularly relevant for people with disabilities who are more likely to be homebound, who are more likely to have multiple providers, multiple chronic diseases. So, there's an enormous possibility here for PHRs to streamline the process of getting care and to make it less dependent on being in the physical place of your of the doctor's office, and also obviously being able to then use it to improve patients' sense of control and ownership over their care, and being able to get those messages saying, hey, by the way, you're due for this or you're due for that, and help us get those numbers up on that 49% we saw earlier.